as open enrollment for healthcare begins, we wanted to make sure that you're paying attention to your heart, because studies have shown that many circumstances can lead to poor cardiac health, including some elective surgeries and oral surgeries, things that we do sometimes all the time and don't even realize it. So joining us live in studio this morning to explain is renowned cardiothoracic surgeon Dr. Peter Segurola. Good morning.
Good morning. Thank you so much for having me.
Yeah, so this is really serious because I don't think a lot of people understand the risk that we can be put at with some of these surgeries. Like, for example, if you're just getting your molars extracted, and a lot of people have that, even young people, can that really cause heart problems?
Sure. The issue is that there's a lot of people that have valve disease.
Okay.
But they're treated, they're either subclinical or they're being treated very effectively. But that creates the perfect milieu that you have some type of invasive procedure, such as you're mentioning, extraction of a mole, a colonoscopy. There are certain occasions that it could seed the valve because the valve is abnormal, although you're clinically fine. And then that leads to a condition called endocarditis, which is an infection of the valves.
Okay, there's a lot of words going on here, and you're the renowned doctor. For me to understand this, and our viewers as well, because a lot of times people are saying, yes, you have to get that yearly colonoscopy. You said the word colonoscopy, so let's talk about that for a second. Some people worry now that, well, wait a second, is this putting me at risk?
Well, not if preemptively you go see your primary care doctor, and then there's certain conditions and there are guidelines that you will be put in antibiotics prior to the procedure, and then you have a safety blanket.
Got it.
The key point is that a lot of people, you've heard the word murmur. They have a murmur. Whenever you're going to get an invasive procedure, you should first see your doctor, your primary care doctor, and there are guidelines, and then they'll put you preemptively in antibiotics, and you're safe.
So with the murmurs and the valve issues, some people don't even know they have it. When should you get screened? How early to detect this?
Well, everybody, especially after the age of 40, should have a primary care doctor, and they should go once a year to visit their doctor. And a lot of things are picked up. And a lot of things are treated and managed by the primary care doctor. If they're more serious, they go to a specialist. But it's all about prevention. That's the key to the game.
So when we think about surgeries and just normal testing, if you will, right, and we don't consider how it could affect our heart, what do we need to consider next time when we're going for this routine testing?
Well, if you go see your primary care doctor, even without testing, just a thorough physical exam will reveal a lot of things. And then only then you might need testing or not. But simple things really go a long way. What I guess that what you want to prevent is something that gets out of control, and then they have to come to see me, a cardiac surgeon.
Yeah, we don't want to see you.
That's the far end, and that's what you want to prevent. But even if you're there, nowadays we can take care of a lot of these problems in a minimally invasive fashion. I'm a minimally invasive valve surgeons. We can do these things through very, very small incisions. And it's,
that's good.
I mean, 2.5-inch incisions, what we used to have to, yes, technology. And we can really perform a lot of things, small incision, and you go back to your regular lifestyle, very promptly.
Well, we appreciate your information. It's way better to see you here in this setting and not on the operating table. Thank you for what you do and the information you're providing.
I would like to thank you for inviting me this morning to have a brief conversation.
Absolutely.